once you get the page on somebody, typically we're arriving, we being like the facial trauma team, facial plastics team, are arriving to to see the patient after they've been stabilized, and they're typically have a neuro check to see if we need to roll them back to surgery now to stop any bleeding, or if neuro has to do something first. So of course, make sure that's all in order: airway, breathing, circulation, all that sort of thing. But once those boxes are checked, first glance, just take a look at the patient. How swollen are they? Can you get anything done right away? Is this NOE involved in a blast injury where you have to address the soft tissue envelope? Think about when you're going to roll this patient back. If they're super swollen, you're probably not going to be able to do much at that time because the midface is already a tight space to work in. So that's always a consideration. Do they have any wild lacerations that are going to aid in your approach to the fracture segments? That's always helpful. On Friday, we had a devastating blast injury where a nitro tank exploded in this patient's face, and it was a complete like predator level degloving to the face. So everything was right there. Access was easy, no coronal necessary. Our whole goal at that standpoint was to restore some of the facial skeleton so that we can, and the soft tissue envelope, so that we can build custom plates for later, but that's neither here nor there. So after looking at facial swelling, any lax, next thing you want to pay attention to is the medial canthal region. Do they have telecanthus? When we think about the intercanthal distance, the average is about 30 to 32 millimeters. Of course, this is race dependent, and there aren't a lot of studies showing the differences in race. There's like one out of the 90s showing that African Americans have about 34 millimeters of intercanthal distance, plus or minus 3 millimeters. So that puts us right in our other range. So it's neither here nor there. Looking at an old picture, if they have one, is helpful to gauge where you're trying to land that medial canthal tendon. But amidst all the swelling at the time, things are going to be challenging to assess all at once.